And welcome back. The American healthcare system is plagued with inequalities that have disproportionate impact on African American communities as well as other marginalized groups. Now, according to the CDC, African American adults are less likely to see a doctor due to high costs, lack of accessible care, or other barriers. Since 1985, MetroPlus Health Plan has built a reputation for providing access to affordable access quality health care to residents of all of New York City. We recently talked with the Chief Growth Officer of MetroPlus Health, Roger Milliner, and we'll go to that interview right now.
Thank you for having me. I appreciate it.
Yeah, and as I outlined in the lead, that when we talk about healthcare inequality, disproportionately affects communities of color. And I know that you're trying to do a good job in terms of bridging the gap.
Absolutely. Here at MetroPlus, we work tirelessly to make sure that areas, particularly areas of color within New York City, have a good representation of minority leaders that can come out and talk to them about things that are affecting them. We work closely with many, city agencies and some community-based organizations, community partners that are also trying to address these issues. So, for example, in Staten Island, we're working on an initiative with the Community Health Action Network and the American Heart Association to bring awareness to men in particular about issues around hypertension and blood pressure, which plague the Black community in many ways. So that's just an example of some of the things that we're doing. We took a barbershop approach because we know that a way to really get people to open up about issues around their healthcare, is doing it in a comfortable environment, a place that they're familiar with. So working closely with the Department of Youth and Childhood Development, we created this barbershop series where we go right into the barbershops and talk to men of color about, hey, these are the issues going on. It's important to have a primary care doctor, et cetera. So.
Yeah. And when we talk about the Black family, obviously a lot goes on. There's some things that some people are aware of, some things that many aren't aware of. But when we look in particularly the African American community, what are we seeing when it comes to healthcare and the things that really need to be changed and addressed?
Well, one, we need to see providers that sort of reflect the communities that they're in. Oftentimes you go into certain communities of color and there are medical professionals at all levels, whether it's nurses or doctors or other support staff that don't look like the people in those communities. And so one of the things that we need is for more African American physicians and nurses to be represented in those urban areas, in those communities, so that people will begin to open up and communicate more with them and trust them. It also would help that we have people of color in those communities because they have a particular sensitivity to the needs of the community. They understand them a little bit more. They can relate to some of the types of issues that they go through. So I think that representation at the clinical level is important, but equally as important is that we have people of color who are in executive decision-making positions. I happen to be the chief growth officer at a major health insurance company in New York City. And I feel that, being African American and sitting at the table when decisions are being made on building certain healthcare programs and products, determining what the benefit levels are going to be, advocating for the appropriate financial and cost mechanisms that go into these health plans. It's important to have somebody of color in executive positions, not just in the sales and chief growth officer position of a plan, but as a medical director, at the CFO level, at the COO level. So having executives who are from the community, who understand the culture, to me is just as important as the clinical aspect of it.
Has COVID really shown you anything by way of the work that you do, particularly when it comes to healthcare accessibility?
Oh yeah, MetroPlus Health Plan is a health insurance company that's owned by a major hospital system, which is known as the New York City Health Plus Hospital Corporation, which is the largest public hospital system in the country. So during COVID, we saw the disproportionate share and an impact that pandemic had on the communities of color. It's no secret that areas like Harlem, areas like Elmhurst and Corona, areas like Jackson Heights, if you turn to Brooklyn, areas of Brownsville were most heavily hit by the pandemic for a lot of reasons. You had compacted amounts of people, congregating in the same place. You think about the public housing system in New York City, where many African Americans and people of color live. It just exacerbated the pandemic and it helped it to spread more. But then you also saw a lack of resources that were being pumped into these communities at a time that was most needed. It took way too long for us to get the right clinical people and staff to deal with some of the respiratory issues that we were having in some of the hospital systems and these local medical centers. And then the PPE distribution was slow to get into these communities. The lack of education wasn't there. So yeah, the pandemic showed itself, particularly around areas of color, as it pertained to limited resources, lack of education, and not a faster move to action in some of these areas.
Yeah. And so I also know that some of the work that you do deals with the LGBTQIA community. I'm also really trying to deal with them in the area of meeting their needs. What are we learning there?
Yeah, I mean, in particular, they have their own set of unique, needs as it pertains to, certain types of experimental procedures that they want to get done. And, MetroPlus is a health insurance plan. We don't really look to minimize or reject or decline services that, particular audiences need. So the LGBTQ community definitely needs to also have representation. So, as I said, we're owned by a hospital system. We have specific medical facilities and clinic areas that specifically cater to that audience. Many of the practitioners and many of the administrative staff are of the LGBTQ community, so they can relate. We go through a lot of sensitivity training around some of their particular needs as a routine requirement for anybody who's a MetroPlus employee or employee of Health and Hospital. And so we're well familiar. We have LGBTQ representation on some of our committees that we have at MetroPlus. We have very specific clinical and medical programs that cater to that audience. And so it's important to include the LGBTQ community when you're developing specific programs and communities, and MetroPlus certainly does that.
Yeah, and I know that one of the things you're doing is really giving an opportunity for them to be able to celebrate Pride Month and your partnership with them. Share with us a little bit about the partnership and how you are embracing and celebrating Pride Month with this community.
Oh, it's been a blast. MetroPlus has participated in all the Pride events. I personally myself went to two. I went to the one in Jackson Heights and Queens, and I went to the one in Brooklyn. And, we truly, stand by what we say. We're a plan that has diversity. And so that audience definitely needs to be celebrated. They need to be represented. They need to be respected. And so MetroPlus is participating in all Pride events that we're aware of and that we can get a sponsorship opportunity with. The big one coming up in Manhattan is coming up very soon, and we're looking forward to that. But yes, we partner with many organizations that are also targeting that audience to make sure that their needs are being met.
So for somebody on the outside saying, listen, I need to get connected, what's the best way for them to get connected in the services that you provide?
So there's a lot of ways. MetroPlus has, and this is important to us, we specifically opened up many community offices right in the neighborhoods that we're referring to. So we have community offices in all the boroughs. If you just go to our website, you can find the locations of our community offices. And so you can meet someone in person. We have recreational vehicles that are positioned in high traffic areas all throughout the city. You can come to any one of the New York City Health and Hospital, acute care hospital facilities, and you'll find a MetroPlus representative. But you can also go to our website at www.metroplus.org, or you can contact us at 855-809-4073. That's 855-809-4073, which is a dedicated phone number that people can contact for more information about our plan and to get assistance with any health insurance assistance in education that they need.
Well, Roger, definitely been a pleasure talking to you. Thank you for the services that you provide, and certainly we'll continue to watch and see how things develop. But as we do see things on the rise, and Metro Health Plus really stepping up to really be an asset to our community. So thanks so much for the work that you do.
Thank you so much for the opportunity. Looking forward to working with you.
All righty. Well, I want to let you know, if you want more information, don't hesitate to visit them at their website, metroplus.org. And then also, listen, follow them on social media at MetroPlus health. Well, we got more show. Don't go anywhere. Open continues coming up right after this.